3, 2, 1, sound test. Test. Test.
Is that live? Mm-hmm.
Hello, hello. Welcome. Thank you for being here with us here in person, here on YouTube, here on Facebook. We are so happy to be in community with you in whatever way you are joining us. My name is Adriana Bolin. I use the pronoun she and her, and I'm the Director of Racial Equity, Social Justice, and Community Engagement at Fenway Health. I am cheesing because I'm just so happy to see the people in the room. So if you see me, it's because I'm just grateful to be in everyone's presence and glad that you are here. Before we get started with our program, I would like to read our land acknowledgement. We'd like to begin by acknowledging that we are gathering today on land that is the traditional and ancestral home of the Pawtucket, Massachusetts, the Naumkeag people and their neighbors, the Nipmuc, and Mashpee Wampanoag, who have stewarded this land for hundreds of generations. As a healthcare institution, Fenway Health recognizes the disparities in health that can and do result from the repeated violations of sovereignty and territory that have impacted the original inhabitants of this land for centuries. In offering this land acknowledgement, Fenway Health affirms Indigenous sovereignty, history, and experience. Fenway is also affirming that American Indian, Native American, and Indigenous communities are present and alive today. There are nearly 5,000 Indigenous people living in Boston, and that we are committed to meeting their healthcare needs. Thank you all for acknowledging with me. All right, so why we are here, this is our second contingency chat with our community. And when we say contingency chat, we are really talking about our coming together and thinking about what do we need to be prepared for? What's informing what we need to be prepared for? What are we seeing in each of our communities that need to be addressed? And how can we support each other in thinking about that? And for folks who are joining us on YouTube and Facebook, I encourage you to participate as the program is going on. Your responses, both in this room and online, will inform our continued conversation and also support in the planning of our next contingency chat. I also wanted to speak to briefly the theme for tonight, which is meeting of the angelic troublemakers, and that is a quote from Bayard Rustin. Bayard Rustin was the architect of the March on Washington in 1968, was an activist and an organizer, and really informs how I want to invite us to think through contingency planning together with us. Tomorrow is the 35th annual Bayard Rustin Community Breakfast that we host, and that was one of the inspirations for inviting a way for us to talk through contingency today. So we'll get more into Bayard Rustin and how that will inform our discussion. Before we move into some framing for our conversation and brainstorming with each other, I wanted to share principles to invite us to consider and lean into so that we can be a part of and create both a physical space and a virtual space for those of you joining online where we all feel respected and heard and a part of this space that we are creating and holding together. And they are called Brave Space Principles. These are principles that at Fenway Health we follow to create spaces that do just as I described. And there's a poem that accompanies them as well. So I'm going to share the poem and the principles and invite you to take them in and consider which of them you'd like to lean into. You can lean into all of them. So, brave space. Together we will create brave space. because there's no such thing as safe space. We exist in the real world. We all carry scars, and we have all caused wounds. In this space, we seek to turn down the volume of the outside world. We amplify voices that fight to be heard elsewhere. We call each other to more truth and love. We have the right to start somewhere and continue to grow. We have the responsibility to examine what we think we know. We will not be perfect. This space will not be perfect. It will not always be what we wish it to be, but it will be our brave space, and it will be our brave space together, and we will work on it side by side. And this is written by Mickey Scott Bay Jones. And now I'm going to briefly introduce each of the principles, and as I invited before, just to consider them and consider them as part of agreements in this space that we are creating and sharing with each other. So they are: welcome multiple viewpoints, own your intentions and impacts, work to recognize your privileges, take risks, take space and make space, notice and name group dynamics in the moment, actively listen, challenge with care, confidentiality, and break it down. So I invite you all to consider leaning into those as we move through this conversation. And as a reminder, we are streaming this on YouTube and Facebook, so really invite you to lean into the confidentiality and share the message and not the messengers as we move into this space of conversation with each other. All right, so back to the framing of Bayard Rustin, a meeting of the angelic troublemakers. What is meant by angelic troublemakers, Adriana? By angelic troublemakers, it speaks to, in times of chaos and challenge, not being complacent, being courageous, being brave. It's really embodying the braveness that we just spoke to in the principles, being innovated, really thinking outside of what we're in right now, what is presented before us, all in the name of justice, really creating systems that are for us, systems of navigating and mitigating where we are together in a way that works for us, by us. I also wanted to speak to some of the principles that were really important to Bayard Rustin. One of them is nonviolence. And when I think and talk about nonviolence, I think about not causing harm, not causing physical harm and psychological harm. And I want to lean back into the brave space principles that I just spoke to. Brave space principles for me, I feel so protected when they're brought into spaces and when they are affirmed and validated by the people that I'm sharing space with. I feel unharmed. I feel like a space is being created where I won't feel harm, or harm will be mitigated. And as we are planning together and as we are thinking about how we might prepare ourselves and protect the rights of LGBTQI people, particularly in this political landscape, I invite you all to consider how might we plan and move in ways that mitigate or prevent harm in our communities. The next is strategic planning. As I mentioned, Bayard Rustin was the architect of the March on Washington, and I didn't hear about Bayard Rustin until I started working at Fenway Health 6.5 years ago. When I learned of the March in Washington, it was always Martin Luther King. I'd never heard of Bayard Rustin, and as I learned the history more and more, it became apparent that the reason why Bayard Rustin wasn't presented as the architect, the person in front of what he was and all that he did for the March on Washington was because he was a gay man. His expression was not palatable to the culture of the front of the movement. And that is why many people hadn't heard of him, haven't heard of him. And I think that's changing now. There's a Netflix movie right now, so if any of you all are interested, it's called Rustin, if you haven't seen it, to share more. And there are more examples like that in our history, across cultures, across intersections. And so it's always a call and inspiration for me to explore more and encourage others to do the same. And so going back to strategic planning now, the March on Washington was planned in very few weeks, very grassroots, mobilized spaces and got people together. They were strategic and very calculated and very organized. Organization is really, really important. And so nonviolence and strategic planning. The last was coalition building, and coalition building across diverse groups. When I think of individuals and the groups that they belong to, I think as humans, we are all so different. There can be an individual that holds the exact same identities as us, and we can still be completely different human beings. And then we evolve. So we're not even the same people that we were before. And so the power of having diverse peoples in a space is we all have a different perspective, or we all have unique perspectives. And the more lenses that you bring together of perspectives, the more powerful the prescription is. And so the blindness, or what may impact our ability to see clearly, can be affixed by expanding our perspective, bringing all of our lenses together. And I'm so happy to have these lenses in the room and the lenses of those that are online. I feel the strength and excited to move into the conversation where we talk about where we are currently and what we need to focus on being prepared for, and what resources and ideas we have in the room on how we can do that together. The last bit I'll share is just, again, bringing in why lifting up Bayard Rustin and his principles. Bayard Rustin, in the time on the March on Washington, that was a march that was to advocate for jobs and freedom and civil rights. And we're in a time now where we are thinking about rights in those areas and beyond for several communities. And there's a lot that can be learned about how that grassroots mobilization happened and attracted the support and participation of people across the country and beyond. And so I bring in the spirit of Bayard Rustin and all that supported him, and the work that continues because of his impact and his support in that work. And so I invite you all, as we continue this time together, to lean into your angelic troublemaker that is nonviolent, that is strategic, and really focused on coming together with diverse groups. So without further ado, I'd like to invite my colleague, Dallas Ducar, EVP of Development and External Relations, to come up and give us a conversation on our current climate, what we are currently faced with, the facts, so that we can move forward together in an informed and organized way. Thanks, Dallas.
Thank you. Thanks. Thank you all for being here. Thank you everyone who is online today. And just thank you for being here, because your presence really matters, whether you're online, whether you're here in person today. Your presence matters, and showing up is really one of many ways that we can resist. So thank you. My name's Dallas Ducar, and I stand before you as a proud queer woman and also an executive leader at Fenway Health. And I want to speak to you personally and directly, because this is personal. This is personal to every single one of us. These are uncertain and they are frightening times. And as a trans person, I won't pretend otherwise. I feel the fear that I think many of you feel right now very deeply. And I also feel something else rising alongside it. Hope, too. Hope in the voices that have reached out to me, whether it's parents, whether it's providers, community members, donors, asking, what can I do? People who are ready to stand up, speak out, and act. And this hope is what's going to manifest and keep going long-term campaigns, long-term work that it's going to take over the next 4 years. It's not showing up for just one day, but it's all of us working together in a chorus. And when someone cannot sing, other parts of the chorus pick it up. And we do this together in a coordinated campaign. And so let me be clear on the very first fact that I can tell you. While we're seeing an onslaught of attacks, particularly in the South, but also in the federal government, against trans rights, against BIPOC individuals, against access to health care, Fenway is not and will not back down. We are not retreating from the front lines of care, the care that we have provided for over 50 years, our advocacy, or the community work that we do in coalition. We are not wavering in our mission. At a time when other organizations have scrubbed their websites and decided to back away from saying certain words, we're not gonna. We are going to move forward, and that's a part of bringing that hope. We will, I want to be very clear, we will continue to provide gender-affirming healthcare. We will continue to provide gender-affirming healthcare to people who deserve it, including families who deserve the care. And we will continue to provide that care because, here's another fact, it's constitutionally protected in the Commonwealth of Massachusetts. It is not illegal to receive gender-affirming care. It's not illegal in Massachusetts. It's also not legal in many other states where we are seeing healthcare providers back down. And so we are thinking strategically right now about how we work together with other organizations to continue to provide this care for those who also need it outside of perhaps our immediate catchment area. We will continue to serve LGBTQ people, BIPOC communities, people living with HIV, and everyone who needs us. Fenway serves about 33,000 individuals a year, half of whom are LGBTQ, many others who are not LGBTQ, who are marginalized in other ways. We will stand up for health equity and those who may not be able to receive care otherwise. We will continue to be a national model of what compassionate, evidence-based, and equity-driven healthcare looks like. Again, this is constitutionally protected care under Massachusetts law. We have a friend in the Attorney General's office, in the governor's office, in the lieutenant governor's office, and the first all-female team in the coroner office in the Commonwealth of Massachusetts. And they are showing up and we are in those conversations. You have a right, and let me be very clear, especially for any trans or gender diverse folks in this room, you have a right not to be discriminated against by state law. It is illegal to discriminate in healthcare, in any type of public accommodations. Voters have voted overwhelmingly to ensure anti-discrimination protections. And that also means your health insurer cannot discriminate against you. You cannot have benefits that are stripped away for for most health plans. There are some caveats that we can go into if we want to. But non-discrimination, that is not negotiable. And we will work with our allies in the Commonwealth, many lawyers, many other advocates, to ensure that you are protected and you are able to get the health care that you need. It's also really important in this moment to be prepared, which we are doing tonight, which we've been doing at Fenway Health, but not panicked. We have to be prepared, but not panicked. And so what we have developed at Fenway Health is a robust contingency plan that covers every corner of our work: clinical, legal, financial, digital, operational. I am one of the individuals who's leading up that plan, and we are working hard every day to make sure that plan is put into action. We are proactively protecting our mission and the people we serve. We are strengthening our privacy and security of our systems, especially for those who are worried about what might be in your chart, for example. For those that are worried about what you can say to a provider and where that data may go. We are actively working with the state to protect that, and we ourselves we've made improvements as well. We're building resilience in our care models, in our provider networks. We are anchoring all of this in clear communications to make sure that we are communicating in a way that no one feels alone in this moment, which is one reason why we're here tonight. And we're doing this critical policy work behind the scenes. You're not going to see all of it in the State House, in coalition, through our Policy Institute, to ensure that there are more protections that are codified. We're not stopping here, and we're working together in coalition. We are proud to be in a state right now where we just had legislative leaders show up for Trans Day of Visibility a couple weeks ago in the State House. We had a full room in Nurses Hall. 2 weeks before that, we had an LGBTQ health equity briefing, and we had a packed room, y'all. We have people in our corner, and that's really important to remember when we're thinking about the facts here. We have leaders who are going to continue to affirm our access to care. And over the past year, we've seen meaningful progress on bills that strengthen privacy, reinforce legal protections, and make it clear that Massachusetts will be a beacon and be a safe haven. We have been active in the State House working with partners to help advance that legislation. Right now, we want our community to know that we are at the table. We are defending care. We are expanding protections. You'll see many of those protections come out shortly, too. And then it goes through the legislative process, and make sure that our patients and providers are heard. And this is really a part of a larger movement to ensure that Massachusetts remains a national leader in protecting dignity, safety, and the rights of all people. And it's not just about healthcare. At Fenway, we do so much research and education. We train new pipelines of folks to keep doing this work. And we create a space where this work gets advanced for years and years and years to come. And so we're actively trying to secure additional resources to protect that research, to protect that education, and ensure that clinical care is provided. We're not just defending, we are building. We are pursuing that education through our institute, investing in life-saving research, and working to ensure that people are not just surviving, but thriving, with access to every single dimension of health and well-being. And we know that this work will take us all. Patients, providers, families, donors, elected leaders. So it's not a solo effort. That's very clear at this point. It's a collective strategy that's rooted in a shared purpose. And so I would have us really reflect right now also on the mission. Fenway's mission is going to endure. Our care will. We have to speak louder. We have to be bolder. We have to organize. We have to make it unmistakably clear that we are not going back. We will not allow fear to silence us. We will not allow misinformation to shape policy. And we will not allow anyone to criminalize compassion. If you're here tonight or watching online and you're wondering, what can I do right now? One, speak the truth, even when it's hard. Amplify stories and narratives, even when it might feel risky. Give your time. If you have it, maybe give some money. Give voice, because this work needs all three. And protect the care that matters, not just with politics, but with your presence. At Fenway, we are going to hold the line, but more than that, we are going to push forward. And we are inviting all of you to come with us, because together, we do more than survive. We are going to shape the future. Thank you for being here tonight, and I look forward to the conversation. Thank you.
Thank you. Thanks so much, Dallas. I'm such a visual person, and as you were speaking, I got brought back to my younger self. I was in middle school, and it's a moment where something got me in a space where I just felt like I was spiraling. I was all over the place, and a friend of mine will have grabbed me like, "Hey, this is the facts. You're a great person. This is just a moment. This isn't your story." And I felt like that's what you just gave us, just we know it seems like all of this is happening in front of us, and here's the facts. Here's where we are today. So I really appreciate the facts. Thank you. It's grounded me, and I hope for those in our space here and virtually, you also feel a sense of groundedness. Before we move into the next portion of our conversation, where we invite you to share what you think we need to be prepared for, and we'll take ideas that might be in the room, and for folks online, we'll take your ideas, and you'll see future conversations around that. So please do share any comments that you have for us. But before I dive into that, I just want to ask if anyone, after hearing what Dallas has shared, if there are question of clarification that you have before we move into hearing from you all what you think we need to be preparing for, and what contingency plans you think we should be putting in place more collectively after hearing what Dallas shared. But any questions or reflections before moving into folks sharing what you think we need to be prepared for? All right, we are clear, we are informed. And so any thoughts or reflections that folks have in the room, and I'll repeat it for folks online if anybody would like to surface any, but after hearing what Dallas shared, what do we need to be prepared for in our community in a way that requires us to come together across the state, across sectors, across identities and intersections? What might we need to be prepared for together? Does anyone have any reflections? And take a moment to take it in. And you can also receive it as a question that you take in and take space to process. But that's the question for anyone that would like to reflect with us here. Yes.
Hi, I'm Brady Wurtzen. I'm reminded of, actually I had the same thought when I volunteered for the Bayard Rustin breakfast, like maybe 12 years ago, I'm coming of age. But and I was like, I've never heard of this person, and he's amazing, and why not? And I think his story of doing the selfless work and then kind of being cast aside makes me remember some of the time I think I've been in spaces where I've sort of felt like the lone person, or, you know, I didn't necessarily feel completely involved, but the work was important, so I wanted to be there. And I guess I'm thinking other lessons or ways to be prepared for being in a space where we are coalescing and building a coalition with others. And we may not be fully aligned, and it may not be such fundamental differences, but differences there will be. So kind of being prepared for that and how to navigate, you know, mission before self, or sort of the right balance of that. I don't know, thoughts or reflections on that.
Received. Thank you, Brady. So just to repeat for folks in the room who are unable to hear, or those who might be on YouTube or online, we had someone here in this space share with us this reflection of Bayard Rustin, who was really cast aside after organizing the March on Washington. And the person reflected here how even in spaces where we might be among different individuals, diverse groups, there may be this feeling where others might feel cast aside because there are elements or perspectives we might not fully agree on, but we have a shared mission. And what does it look like to really lean into and commit to that shared mission? Does that capture what you offered? Yeah. And so really being prepared for, and I'm sharing my reflection, that's why I love Brave Space Principles, because we may be different people, we might have different things that are important to us, but can we agree to how we engage and work with each other in a way that feels good for all of us? So thank you for lifting up that up. How do we work together across differences? How do we move our mission forward, even if we may have some difference in perspectives or approaches? Thank you. Any other thoughts or reflections that folks want to bring into our space as we think about what do we need to be prepared for? What contingency plans? Yes.
During all this, I kind of feel like the student who was abducted by ICE in Somerville tells us like an informative lesson of like, you know, the tactics that'll be used against not just immigrants, but also against trans people. And I think we need to consider the extrajudicial ways that we will protect ourselves, because as we can see that they're doing things that are incredibly harmful and hateful, that are legal, and I think the legal systems that we have right now do not have anything like in place to protect us, and the legal systems will protect the people doing this harm. And I work as a paralegal. I kind of came here to network to get away from the kind of law that I do because I don't feel like it benefits society in any way. I want to get more involved in like legal protections for queer people and such. And a cop lied, and the judge believed him, and I lost my case. And I feel like what we see all across like the country right now is that people are brazenly defying laws and lying and getting what they want. And I think as queer people who need to protect ourselves, you can't depend on the legal system. And I feel more and more that we need to make preparations that are extrajudicial, because the legal framework that exists today is harmful and is unjust. And I don't know, it doesn't feel like there's things that we can do that are legal that are enough to protect ourselves in this climate.
Yeah, thank you so much for sharing. I'll repeat what I heard, and you let me know if there's anything else you'd like me to add as we lift this up into this space. And so the person who we have here in the room shared that here in Massachusetts, just in case those of you might be joining from outside of Massachusetts or might not be familiar with this, but we all watched an unfortunate experience of a tough student here in Massachusetts was taken into ICE custody in a way that was very unjust, justified by laws that are unclear and appear to be and feel unlawful. And that expression, that vision of experience, as both the LGBTQIA plus communities and other communities' rights are being threatened, we see those visions of experience and we think about what we need to do to protect ourselves as a community. How can we come together and care and protect for our communities? And how might we do that aligning with forces that we can trust? Forces that we know will show up and protect us. What does it look like to build protection and build coalition for protection in ways that we know that we can hold accountable, that we know is a part of a system or practice that doesn't produce inequitable outcomes, doesn't produce violence, does not produce psychological and physical harm. Does that capture what you were saying? Would you like me to lift up any other things in this space?
I don't know, there is violence being brought against us. And I don't know how far non-violence gets you, like within a legal framework when the law is so pointed against you. And you can appeal and you can point out hypocrisy, but at the end of the day, that doesn't really matter.
Yeah, I appreciate you sharing that, and I'll lift up the mention of the reality that we are, as a community, as communities, are experiencing violence, and we need to protect ourselves. We need to come together, and what does coming together is? Actually, I want you to say it in your words, because I want to. Do you mind repeating what you mentioned? Thank you.
Just that I feel like there is violence being brought against us, and at a certain point you have to defend yourself because there's no legal defense, because the legal system does not defend you and the truth does not defend you anymore. That you have to consider, like I said, the extrajudicial measures to protect yourself, because it doesn't matter if you could point out that, you know, your friend that got taken away, that was illegal or whatever. Like, it doesn't matter if they're already in Louisiana in a detention facility. Like, if you have the law on your side and if you're right, like, it doesn't matter because your friend's already there. And I think, like, it's not really like, you know, pointing or throwing your spear into someone. It's holding your spear close to yourself and just trying to defend yourself, because the law is not, no one respects the law anymore. Like, the agents are gonna come in and do what they wanna do, and then they're gonna ask questions later, and if you're gonna respond to them after the fact and then, make an appeal, like, it's already too late. So I'm just wondering what the measures are to protect our communities are before we even get to that point.
Yeah, thank you so much for elaborating on that. And as you're speaking and thinking about, what are the extrajudicial tools or measures that we use to protect ourselves, I'm thinking about an Audre Lorde quote. Audre Lorde, poet and writer, writer of the Cancer Journals, as one example of the work. Audre Lorde says, "The master's tools cannot dismantle the master's house." And as you're thinking about, how do we protect ourselves? And I thought of the word tools. When I think of approaches and ways to do what I need, I think of what tool do I need? And I'm like, it's not the master's tools. It is not the tools that are being used against us in the way that it's being used. So what tools can we produce, can we create together to protect ourselves? Yeah, thank you. Yes.
I'm about to be 62 years old,
Yes.
and I was born in Mississippi in 1963, a few weeks before the March on Washington, and subsequently after that, the bombing of the church in Birmingham. And in that year that I was born, my parents were the leaders of a little black church in a little town called Wiggins, Mississippi, population 1,590. And they were out of their little black church, like a lot of churches, registering people to vote. And that year, 60 black churches were bombed. And most of them, not our church wasn't bombed, but most of them were bombed when people weren't there. And so the Birmingham bombing was unusual because it took place on a Sunday morning. But the word that comes to mind for me that I would invite us all to think about is civil disobedience. Because people, our history in this country and in South Africa and in Haiti, there's so many examples of resistance, of people finding creative ways to survive and prosper and turn things around. Toussaint Louverture in Haiti, there were a lot of revolts during slavery. Here in the US, the civil rights movement, of course, lots of stories. So I would invite us to think about and look for those examples. And also to remember in our own recent history 5 years ago, when a form of violence, destabilized our countries and our communities, and we found ways individually on the local level to support one another who needed things that they couldn't necessarily get at the time. So I, although there are a lot of people in my immediate orbit who are trans and who are being terrorized, I feel hope by those of us showing up and asking these questions. I believe in community. I believe in the possibility of our better angels. So what did you call them? Troublemaking angels?
Angelic troublemakers.
Angelic troublemaking angels. And I really so appreciate Dallas for her example of all the things that Fenway is doing to lead the way and to be unapologetically, standing for rights. So I'll pause there.
Yeah, thank you so much for your contribution. While you were speaking about inviting us to be civil disobedient as we're thinking about how to navigate these times, the word Sankofa came to me, and Sankofa is an old African proverb from the Akan tribe, and I'm a visual person, so we're gonna get into it. So the Sankofa is a bird, and it's standing with its feet positioned in front of it, and its head is turned behind it, and it's looking back. On its backside, there's an egg, and the egg is it's the jewel. It's that learning of an approach that we used in the past that actually got us to this space that we are here, which is different from our past. We are in a future that is different from our past, and it was that jewel that got us there. So it's about, as we move forward together, really looking back and remembering what we learned. So the individual here mentioned, the revolt in Haiti, Toussaint Louverture. We can look at the civil rights movement. We can even look to different countries where this same act is done. I also think about, when I think about the Underground Railroad and the work that Harriet Tubman had done to bring people to freedom, this freeing, this ease, it's our ability to look back at those. And there's so many moments in time and histories that I'm not capturing, and I'm sure is in the perspective that we all have in this space. If we uplift those stories, going back to what Dallas invited us to think about, if we uplift those stories in our histories and we bring them in this space and we see the thread that runs through them, that's the thread that we can continue together in this space today as we continue to plan for our future. When we are in the future and we're looking back at this point, what will we say that we came together and created to bring us to that future? So thank you for that. Any other reflections that folks would like to share on what we need to be prepared for? We've talked about thus far being prepared to be in space with diverse people, with diverse perspectives that may have different ideas and approaches, but we have a shared mission. And how do we move together in harmony in that shared mission? We talked about our protection and how do we explore extrajudicial approaches to protecting ourselves, to protecting our communities, ways and approaches that we can trust, that we can depend on, that we can count on, with people and individuals that we can hold accountable. And we've talked about, how can we move in ways that are civil but disobedient, so to speak, in this construct, in this system that we are in that is not producing positivity and respect, and I could use so many other words. Any other reflections of things that we need to be prepared for, or just what might be coming up for you as you're hearing what others are sharing? Yes, thank you.
Yeah, I'd just like to know, or the healthcare providers should be thinking about how we will continue to provide care for transgender people and people with HIV and others if the federal government blocks that type of treatment from ACA healthcare plans.
Thank you very much. Dallas, any comments on that for
Sure.
the moment?
Yeah. So a couple comments on that. We know the
Can
federal.
you restate the question? Sorry.
Oh, yes. The question was, what are we going to do? What are healthcare providers going to do? What are other folks going to do if the federal government tries to block coverage of gender-affirming care on ACA plans? Is that correct? And HIV care too. Yes, thank you. What I can say is that we do know that the federal government has already moved to eliminate or work to eliminate gender-affirming health care coverage as an essential health benefit. And so as an essential health benefit, that would then disproportionately affect those who are marginalized already and who are generally also in states that might not have robust coverage, especially for those who are uninsured too. And so the essential health benefit requires there to be coverage of a certain service. And right now, we at Fenway and many others have been providing comment. That is the first part of this. It's through administrative
I think I'm
procedure
just gonna take a picture.
to and encourage others to provide comment to HHS to say
for
this
showing.
is not something that's in line with our values and it is illegal too. There's also some precedent against discrimination around sex and gender identity too. And the Supreme Court has ruled in Bostock at least that that was upheld. And so, there may also be legal mechanisms here. I can assure you that people, lawyers, advocates will be suing to ensure that there is protected and continued care. And then there is also the individual states and what the states are doing. And, to be very factual here, Massachusetts does rely very strongly on federal dollars to help its budget, to make its budget whole. And so we are entering into an unknown budget year. Congress has just moved forward their budget, and that will, we haven't seen it fully yet, but there is some indication that there might be cuts to Medicare there too, for example. And that means that there'll be less coverage of gender-affirming care or HIV services too. I was at the Speaker of the House of Massachusetts breakfast yesterday morning, and he spoke very clearly about the need to protect healthcare access. There's also a lot of different folks in different parts of the government who are working to protect that access and to consider creative ways to continue to fund that for people who are uninsured too. And so part of it is going through the administrative process, and I would encourage all of y'all, if you feel so moved to provide a comment, you're welcome to provide a comment too on HHS's website under the essential health benefit coverage. Separately, there's also the legal remedies too and actions, and that is going to go through the courts. And then there's what individual states are doing too, and that includes continuing to fund the care, cover the care, and then also continue to support federally qualified health centers, because federally qualified health centers, which are bipartisan, they're supported by both parties historically, have a charge to care for patients regardless of their ability to pay too. So that means at Fenway Health, if someone can't pay, we are still going to provide that care. Now that comes out of our own finances versus someone who might be covered on Mass Health, right? But we will still provide that care. And so continuing to reinforce that safety net, those community health centers, will also ensure that care continues to be provided, even if it's not covered necessarily under the ACA. Does that help answer the question? Okay. Great, and I'll just say too, there are national coalitions talking about this, thinking about really creative ways about how to ensure that care does not go interrupted. Providers thinking through everything around this, obviously in any way that is legal, and continuing to ensure that people get this constitutionally protected care. And so I would just say, continue to have hope here, because there's a lot of people working daily to make sure that this care goes uninterrupted, regardless of who is paying.
Thank you so much for your question, and thank you, Dallas, for your responses. We have some action online, so I want to uplift some of the voices that we have joining us online and offer some responses and reflections before taking any others in this space before we move into choosing one to think a little bit more about together. So online, we've had someone share, good evening. How can we mobilize a resistance similar to the hands-off demonstrations across the country? Where is our March on Washington? Who is our Bayard Rustin? Who is our MLK? I love the energy behind this invitation and call to action. And, last weekend on April 5th, when there was the Boston Hands Off demonstration, I saw that energy. I saw a lot of Bayard Rustins. I saw a lot of MLKs. And I also feel that it's not going to be the last time that we come together in this space. And I'm so glad to see and receive your question, because we as a collective need to continue to think about how do we come together and share with people space where we are collectively advocating for our rights. How do we take up space? What I loved so much about seeing those demonstrations across the country, being a part of the demonstrations here in Boston, was we were taking up space and we were capturing attention. There's too much right now happening that is capturing our attention, that is capturing our nervous system, dysregulating our nervous system. And the more that we can be together in a collective is powerful. So thank you so much for that question. And how we do it is we come together. We start in spaces like these, or we continue in spaces like these, and we continue to plan and organize. So thank you. We also received another question that asked if we had any immigration rights and safety resources. I have a resource to surface, the MIRA Coalition, M-I-R-A, Coalition, C-O-A, Coalition, COALITION.org. I got it, thank you, got confirmation. They're awesome partners and a resource. And I just wanna look to my colleague. Any others you might wanna uplift?
I'll keep thinking on it.
Certainly, we'll continue reflecting, but definitely invite you to check out MIRA Coalition, and thank you for asking that question. Welcome, welcome. Any others in our physical space here, our virtual spaces on YouTube and Facebook that would like to share after hearing where we are at and what we are faced with at this moment, the facts. What might we need to be prepared for? And I'll repeat again what we heard about. We heard about, how do we support spaces to for people of different identities, experiences, perspectives to work together towards a shared mission? What does it look like to create and maintain a space that does that? Also, how do we protect ourselves when violence is clearly coming at us? What are our extrajudicial ways that we can come together as individuals and as communities to protect ourselves? What tools and approaches can we use to that? And also, what can we look to our history? What can our history tell us about how we move in ways that are civil and disobedient and disruptive to this system, this norm, this culture that we are in right now and are breaking out of for our rights? Does that capture what we've heard so far, what you all have uplifted? Any others before we move into one that we might hone in on for this evening? Any others? Yes.
I think, looking towards our history, and with things like the Civil Rights Movement, looking towards the history and resilience of the LGBTQ+ community is a beautiful guide when it comes to looking at how, as folks like the federal government in action right now are trying to strip us of the rights and protections we fought so hard for, and an idea, a guide of how to continue moving forward. And we also have our brothers, our sisters, our siblings in other nations and areas around the world who have not yet gained these legal protections, who don't yet have, access to wonderful resources like informed consent, gender-affirming care clinics, looking at how they survive and thrive and support one another, I think is really critical. And I think a big thing there is that idea of community building and showing up for one another, however that is we're able to, for those who are privileged enough to have financial resources they can share. Very important. But I think we all enter these spaces with skills and experiences that we can help contribute, whether that's, you know a lot about sex ed or gender affirming care access, sharing that information. If you're good at writing or art, using those skills. If you're comfortable making phone calls, being a person who's out there calling representatives, helping others to do so. There's so much we can share and do for one another beyond the financial, and just taking the time to do that, even just taking the time to be a friend, to be there for a neighbor, is important, and I think has gotten us through these moments before, and I hope will get us through this moment now.
Ooh, a word. Thank you. Thank you. A word. Ooh, taking it in. I was like, oh, I wish I was sitting in a chair as an attendee because I just want to, ooh. Okay, soaking it as a sponge. I will share with you all what we were just able to hear into the space. So we had someone uplift or continue our thought around what we can learn from our history. We have the civil rights movement. We have the LGBTQ rights movements. We have the Stonewall riots, the riots that happened before Stonewall, that happened after Stonewall. We have countries across our world who don't have the legal protections that we do, and they have cultivated their own ways of continuing to live, continuing to resist, continuing to exist. What can be learned from those siblings from across the world? It reminds me of, I was at a conference on HIV prevention and treatment a year ago, and I was in a room with colleagues from a sub-Saharan African country that's escaping me right now, and we were talking about HIV criminalization and how their current advocacy initiative was for HIV to be decriminalized. And I'm coming, and we talk about that lens of perspective, I'm coming in from a state and country where HIV is not criminalized. And so at first thought, in my privilege of living in a country where HIV is not criminalized, I'm like, no, like we need to shoot for the stars, like criminalization, we need to do this, like that. And it, the person with compassion and patience was like, listen, girl, okay, it was compassion, patience, and realness. Like, hey, we recognize where you're coming from, and I so appreciate how they walked with me with care, because they could have been like, okay, you and your privilege, you have no idea where we're at. But they said, look, we recognize where you're coming from, and we understand that criminalization is not something that you in your state and your country have to contend with. But we have just gotten to this space where our political leaders and our supporters and advocacy groups are thinking about how do we continue to support decriminalization? How is decriminalization a step then to a space where people feel respected, where stigma is where spaces are more stigma free than stigma than mixed up with stigma? And it just helped me understand how, as you suggested, we can learn from other places, how they are existing. What we are contending with right now, there are places and that they are still in that, and they have been in that for centuries, for generations. And what can we learn from that, and how we can come together? So I really appreciate what you've uplifted.
Was that Uganda?
Yes. Yes.
Famous.
Yes. Uganda.
Yeah. And I also think in this time too, when we look back to the civil rights movement, especially thinking about how is it that, when Dr. King or others were trying to speak to others, it was speaking, by pulling up a chair at a diner and having a conversation, for example, right? Or sitting in, but having a conversation that is about a story, right? It's about a narrative. It's about shared values, trying to find some shared values. And I think what the moment also calls us for too, when we look back at some of this other work, is how do we create spaces with those who may disagree with us too, and create coalition with those who may disagree with us, not disagree with our existence or identity, but those who may have a different opinion. How we create that larger tent, right? Because the only way that we really build substantial coalition and cut through the disinformation and build a continued movement is by engaging with the folks who they're not over here and are strongly against you and your values, but they may not know, right? They may not fully understand. There may be disinformation in a world of constant distraction, right? And so I just also want to bring in the civil rights movement especially, the importance of the shared values, those stories, and the discussion with those who may disagree with you, to widen the tent.
Thank you, Dallas. Widening the tent. And I think that's great framing as we move now into what might we want to spend a couple minutes thinking and talking about with each other. We've talked about creating this space where we can lean into our shared values toward our shared mission, a space where we feel protected, a space where we are disrupting the system, a space that is informed by memory and history of how we've been here before and how we got through the moment to get to where we are now and how that will position us as we move forward. Thank you all for your contributions thus far. So I want to invite us to choose or hone in and focus on the space, the tent we're creating, the prescription that we're strengthening with bringing together all of our lenses. I want to ask has anyone been a part of a space where you're with individuals that may have different opinions but have shared values? And if you've been in a space like that, what are the characteristics of that space? What enables individuals to focus on the shared value and the desired outcome? Yes. Oh, and then, okay, we have two hands up here. First one.
It immediately makes me think about the dynamics of family, that oftentimes we may have very, very differing perspectives and experiences, but having that shared experience, oftentimes growing up in a family, having that consistency of value, especially relating to the place we may have been raised to. I also think so often in work environments that in this particularly polarized kind of space where there seem to be very like you're on one side or the other, that being able to bring even work environments back to mission and values and talk about things like kindness and inclusion that we can all center ourselves around and then build from that center space.
Thank you so much.
That's what I was going to say. What I was just saying, just name it. Name what are those values. Call them out. Call out the names of those values in order to invite us in. And I was thinking also about my own family and how we supposedly have shared values. And what I try to do is name those values, say them out loud, and try to invite us to live those aspirations. The other thing I wanted to say about resistance movements, not all of them were nonviolent. Malcolm X said famously, by any means necessary. So while I believe that Sarah McBride, the new Delaware U.S. representative, was on a call a couple of weeks ago talking about how she's able to, as a Democratic elected member of the U.S. House, reach across the aisle to Republicans who see her not as a trans person entirely, but also see her humanity, and that requires the one-on-one showing up and listening and asking people questions and treating them with respect. And the essential element of all of this is love. I admire that about the civil rights movement here, But it wasn't true in South Africa. Nelson Mandela, was not a nonviolent resistor. That's not how he landed in jail. So it will take all of us showing up, as Arthur Ashe used to say, showing up with what we have, where we are, and doing what we can, each of us individually, and that collective outcome will come from us doing what we can, because not all of us can do it with love.
Yeah. Thank you both so much for your contributions. For folks who are online, we talked about, as we're thinking about how might we as people come together and lean into our shared values, and what examples can we look to in our lives that model that. We talked about our families. We are different than individuals in our families, yet we have that shared experience, that shared value that connects us, that we relate to each other with, that we lean into. And in the same way that we may do that with our families, chosen and otherwise, we can do that together. We also talked about naming it. Name those shared values, see them. What do they feel like? What do they look like? Really bring it into our awareness. And then there was this, then there's a comment on how not every movement was nonviolent, and really inviting us to allow people to show up to the table in the way that they can, because all the ways that we show up will get us to where we need to go. And so whatever way, there's a way for all of us, there's a role for all of us, and we want to support each other in honing into that. And so thank you also for uplifting that into the space. Any other comments and reflections on how we create a space where we can work together towards our shared mission, honing in on our shared values? Yes.
Thank you. Yeah, I'm thinking about, as somebody who loves history, I've studied history. I think history is really important and helpful, and history hates nuance, and history loves neat sequences and timelines. And that's kind of the power of storytelling. Is, we've had events here in the past where people who lived through the HIV/AIDS crisis of the 80s would tell us like how it really was, and you kind of make it real. Storytelling just knocks down the preconceptions that we have from what we learned in a textbook or didn't learn. But it's hard to get to the point where you have the space for those stories to be told. I think it's just like literally having space together with others who maybe don't have the exact same background as you. And I think often, at times, coming from different values, knocking doors, I'm knocking on doors in Pennsylvania for the most recent election. There may be people I talk to who are like, I hate most of what this person stands for, but I hate the other guy more. And it's like, oh, okay, maybe we can agree on that. It's not the outcome I wanted, not what I wanted to hear, but we found that one thing that we could kind of agree on. I think the stories are told though when you start with vulnerability, and it really truly is not fun. It's not comfortable. That's kind of the point. But the more that you can have that space and you have those stories told, and you're receptive and you listen to stories, not lessons, that's the power of that, I think.
Thank you so much. The encouragement to really come together in spaces with different people and lean into vulnerability. We need to see your humanity. We are human. We need to see it, because the it in you needs to combine with the it in us and me, and that is what's going to allow us to get to this place that we are looking to be, get to a place where we have what we need. Thank you. Any other reflections about how we come together and create spaces where folks who may have different opinions, come from different backgrounds, can lean into that shared value, those shared values?
Yes, we have one more.
Maybe just to add
addition to helping to share like real factual information and reinforce like what is actual knowledge in the world and not so much of the misinformation that is spread about, but really trying as best as we're able to afford everybody the opportunity to be heard. That to really try and meet someone where they are, an important starting place is always going to be about letting them share that in a way that feels free from judgment, to get to a space where it's okay to talk more. And that's, I think, where we really have, as you were describing too, it may not be the far right extremist opinions that we're going to sway, but there's so many people in the middle that are either lacking the opportunity to kind of work through and process some of what they're hearing, thinking, that may be in conflict with what they've understood or experienced in the past that they're trying to move through now, but to do that in a way that's allowing them the sort of grace to kind of step out of a place of discomfort into like, come on, it's like we can work on this together.
Thank you so much for sharing that. One of our guests in the room reminded us how important it is for there to be space for processing, to allow people to feel comfortable to say what's on their mind. Our guests acknowledged that we're in a time where we're trying not to take in misinformation, and we're trying to be clear. And in that, there are individuals who are at different places in their journey. And sometimes in that journey, it's helpful to just be heard and to be seen and valued and respected and where you're at and your process. And as you share that, I think that's another valuable quality of a space that we share, where we are leaning into that shared value. And you just expressed a shared value, where someone is offered the space or provided the space is created available for them to ask questions, to be vulnerable, as you mentioned before. And I think about my own learning journeys. I've definitely had experiences where I might not say something because I'm like, I think people might think I should know this already, and staying in that ignorance prevents my own expansion and the expansion of people connected to me, because when I'm exposed, then the network of people that I'm connected to have the opportunity. I think of the ripple effect. There's that drop of water and it goes and it just spreads, and if there's a space for me to receive that, it can reverberate to others. So I really appreciate you sharing that as a characteristic of the space we share together. We are coming close to our end, and I really appreciate all of your contributions, folks here in the space in the room, folks online who are watching on YouTube and Facebook. So grateful for you being here and all that you've shared here. I'm already thinking about, okay, how might we apply everything that folks mentioned in this meeting today in our next contingency chat. And just to share, we facilitate these quarterly, and all that you've shared really has me thinking about how we might continue to lean in more to those characteristics that you all talked about, and how we can hone in specifically on topics that you all mentioned here around protection, mentioned around vulnerability, and really thinking about how we disrupt what we're contending with in a way that we have access to, that contributes to the greater good. Any last reflections in this space or online before we conclude? Yes.
We're at a health center, so it seems to me we should talk about how to take care of ourselves. These times of terror are depleting, and so we need to rest. We need to get some activity, to exercise, to move our large muscles, to metabolize the stress, to mitigate the impact that it is having on our nervous systems. So I just wanted to invite us all and remind us all to rest. Even if you can't get the activity, please let us rest. And whatever ways that we can imagine to take care of ourselves, we should try to do more of that, because the need is greater now.
Thank you so much for that reminder to take care of ourselves. How do we take care of ourselves? And you uplifted resting, really resting and taking care of ourselves. And I'll offer a few others, and if others in this space want to share more as well, but drinking water, remembering to eat. A couple others that I'm reflecting on today. I got so many really good hugs today, and it just, it fills me. Something happens in my body where I just, and then, I know different people are different, but I like to be squeezed. It just, I don't know, it does something for me. And the last thing I'll share is I love sharing a smile. It's just there's something that releases in my cheeks. Like I don't even know that tension is there, but I'm smiling. What I love, especially when I'm not smiling, but someone smiles at me and them smiling at me leads me to smile. Those smiles really hit my heart. And so thank you for the invitation to remind ourselves what we do to care for ourselves and what we can do. Are there any ways that people care for themselves or are caring for themselves or would like to that you want to bring into this space to share with folks?
I just want to remind everyone that it's okay to say no as well, too.
Exactly.
I think in spaces like these and folks that, when we have a shared mission, we want to say yes to everything, we want to be there. And being able to say no helps you prioritize what you're saying yes to. And so that's really essentially vital. And also, we all don't have to do yoga, and we all don't have to do meditation. We can zone out on the couch and eat some chips and watch some Netflix and do whatever fills your cup, right? And that's the power of coalition. Because if you're saying no or you're on the couch, it doesn't mean that everyone's doing the same thing. We can always pass the torch on to the next person. We can get back up there when we feel the time's right.
Yes. When to say no, or just to say no. And Netflix, ooh, or whatever your delight. Hulu, Apple, all the things. They're not sponsoring me, so I'm gonna stop. But just whatever your form is, just embrace it. So thank you for that reminder. And I'm thinking about what you said earlier, because when I was younger, I was growing up, I was in a choir, and that whole you can stop for a moment, the choir will keep going. I definitely stopped sometimes, especially when it was a long note. And it felt so good to just stay in place, and if the pictures were taken or the video was happening, I still looked like I was doing it. But the choir got me, and we got each other. And that is why coalition is so important. Any other reflections before we close out our time together? Eternally grateful for the time that you all have shared with us, the space that you've shared, your thoughts, your ideas, your energy. Looking forward to seeing you all in 3 months from now when we have our next contingency chat. I look forward to hearing more about the work that you're doing, the ideas that you have. I look forward to brainstorming with you, invite you to bring a friend, whether virtually or in person. And if you have any other ideas or things that you want to chat about, if you're in person, you're welcome to stay after and share them. If you're online, please drop it in the chat. You can direct message us as well. We'll get back to you. But thank you again for joining us, and have a good evening. Thank you.